Just a few weeks into the school year, and we're seeing a dramatic rise in the number of kids being diagnosed with COVID. Joining us live this morning with more is Mercy Medical Center pediatrician Dr. Ashanti Woods. Good morning.
Good morning, Mindy. How are you doing today?
Doing well. And what do you think is behind the rise in cases among children? Is it back to school?
A couple different things. One, it is in fact back to school. You got more moving pieces. You got kids on the bus, kids in the classroom. We also have the Delta variant. The Delta variant is, as we know, very transmissible, not only in adults, but in children as well. And then we have more testing taking place as well. So when you add all three of those together, plus a couple of different other factors, we're going to have an increase in cases.
So let's talk some more about the Delta variant. Is it more dangerous to kids?
It depends what you mean by more dangerous. It is more infectious or transmissible. At one time, we thought the novel coronavirus could affect adults, and adults were more likely to transmit it to children, but not the reverse. Children couldn't transmit it to adults as regularly. We're seeing with the Delta variant, that's not the case. Adults can pass it to kids, kids can pass it right back to adults, kids can pass it to other kids. So we're seeing that it is more transmissible. In terms of more dangerous, are kids getting more sick? We can't quite say that, even though the number of hospitalizations are in fact increased. The reason that is not only because of coronavirus, but then there's also another virus called RSV, respiratory syncytial virus, which was causing an increase in hospitalizations as well. So we had a perfect storm, if you will.
Yeah, I heard about that RSV situation. So what are you hearing about a vaccine for children under 12? They currently can't get vaccinated. Is that coming anytime soon?
So Pfizer is supposed to submit their research sometime this month, September. We think it'll be the very end of the month that they submit. Then it's going to be up to the FDA and CDC to review that data. The forecast right now is late fall, early winter, if there is an approval for children ages 5 to 11. That still means that there'll still be children, those under 5, who won't be protected necessarily with a vaccine. So we as pediatricians, we're encouraging children, if you're 12 and older, that's the age that can get vaccinated currently, to consider strongly being vaccinated. We think about 50% of that population, 12 and older, has taken advantage of being vaccinated. And if you, a parent, or if you, the teenager, have questions and concerns, we want you to have a good conversation with your pediatrician because we do think that it is an effective vaccine and is going to be a major role player in stopping coronavirus and coronavirus cases.
What advice do you have for parents should their children come down with COVID? How do you treat them at home to make them more comfortable and get them better sooner?
So advice for parents, one is going to be remain vigilant. So making sure your kids are wearing their masks, social distancing, not letting our guard down. To answer your question, if their child has COVID, usually it's going to be a 10-day holding period. In other words, that first day of symptoms, which might be a little tricky, first day of symptoms, your test might come a day after you had symptoms, but 10 days after your symptoms, you'll be able to return back to school, return back to sports if the child is healthy. But at home, it's going to be supportive care. Fortunately, most children actually end up with mild symptoms from coronavirus. However, it would be remiss for me not to acknowledge we've had over 500 pediatric deaths since this pandemic began. And again, you as a parent, you have to take that very, very seriously that, not all COVID is the same, so to speak. So we want to continue remaining vigilant. We want to tell parents to hang in there. We know this has been a very long process, but we do feel that there's light at the end of the tunnel, but we want to make sure that we don't let our guard down. That's probably the most important advice.
All right. Thank you, Dr. Woods. We really appreciate it. Have a great day.
Thank you for having me.